5 tests to determine if you have a pinched nerve in your neck. A pinched nerve means there's pressure applied to a nerve as it's exiting the neck.
Right.
It comes into your arms and provides sensation and strength. Now, the pressure could be from a disc. It could be from a bony, like, overgrowth.
You're right.
Spur, I suppose.
Right.
It could be from muscle even. Muscle
Sure.
can tighten up over.
Some inflammation if maybe they had some trauma.
5 things you might see, and then
Sure.
we'll show you 5 tests.
Yep.
You might see, pain radiating to the arm, and especially if it goes beyond the elbow.
Yes.
Because regular pain can even go to the elbow.
Right. Or sometimes shoulder pain will radiate down,
Right,
typically
right.
to the elbow.
If you have hand, arm, or shoulder weakness, that could be a pinched nerve. It could be other things too, so you always want to make sure you're going to a doctor to check these things out. If you have numbness or decreased sensation in your arm, wrist, or hand, now this again could be carpal tunnel, or it could
they overlap, and
Yep,
this is one of those tough ones that's not always easy to
it could be pinched
clarify.
nerve anywhere. You know, it could be a pinched nerve in your elbow
Right.
that can send pain down to your forearm and hand. All right, if you have tingling, pins and needles sensations, the same thing down in this area.
Right.
That would often or can be a sign of a pinched nerve in
Sure.
the nail. Sometimes you have both. Pain in the arm, wrist, and hand, which is aggravated by any neck movements.
Yep.
So like if you move your neck and, that hurts down here.
Yes.
That's a pretty
right.
good sign, actually, that you have a pinched nerve. Feeling the hand fall asleep, which, on my hand will fall asleep if I sleep with my arms up over my head. But,
right. Yeah.
But
yeah.
if it's falling asleep and you're not really doing anything to it, it could be a pinched nerve.
Pain in the shoulder blade area, that's a good possibility. It's coming from the low neck too. Typically, shoulder pain goes down the arm or in front. It doesn't refer backwards. So that's another thing to keep in mind as well. And sometimes you get shoulder pain and then it radiates down.
Right. So we're going to show you 5 tests now. The first one's for the median nerve.
Okay.
So you just take your arm, you bend it, and then you bend your neck away.
Yeah.
So you bend the wrist and then bend your neck away.
Elbow needs to be straight.
Straight, yep. That's putting a lot of stress on that nerve is what you're doing. So same way on this side, you bend away.
So you get it up level and tilt your head away.
Yep.
Not looking, but sideways.
So this next one, so this is the ulnar nerve. So to get the ulnar nerve, you make a circle like this, and you actually bring your wrist like this. Now, what I found with a lot of people, they can't even get it very far. They can only go like this.
Yeah. If you're younger, you can.
If you got good motion of the ulnar nerve, you can get you're trying to make an eyeglass.
Yeah,
basically.
but don't do this at the same time.
Yeah.
But that, when we were kids, we used to do that.
Yeah.
That's how I remembered it in PT school.
Right. So you test it, and then you actually can bend away while you're doing it. If that brings on pain, that might be your ulnar nerve involved. Radial nerve. So you're going to stand. I'm going to go ahead and stand on this one, Brad. Face away, and then you're going to lift up like this.
Okay.
And bend away at the same time. This is it's called Spurling's test or Spurling test. This is an overall to check kind of all the nerves here.
Yep.
And what you're going to do is you're going to extend your head and tilt to the painful side. Then you can actually apply a little pressure, gentle pressure.
Straight down.
Yeah, straight down. And you're compressing the spine together and you're closing off those holes, the foramen. And if there's a pinched nerve there from that area, it's going to make it worse. Once you check out, see if you get relief from a position. So let's say I'm having pain in this arm here.
Yep.
I'm going to put it on a pillow and support it.
Sure.
And I'm going to tilt away. And now I'm opening the holes up here. There's plenty of room now for the nerve to come through. It's being supported. And does this give you pain relief? Well, if it does, then you may have a nerve issue. All right, this video is part of a series of videos on neck pain. They're all free. Just go to bobandbrad.com,
That's right.
go to the program section, look for neck pain,